Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you again about double jaw surgery. You think we're hung up on surgical orthodontics here today, but these were scattered out over a period of time, and someone sent this case to me. I think it was the old surgeon wanted me to do this case, and I did it with his advice on different things to do. And the maxilla, if I remember correctly, he sectioned the maxilla and working on it. He was an excellent old surgeon and did beautiful work, but it's complicated work. But if you really get going in orthodontics and you knows you can do the surgical part of the orthodontics, then he'll get you to do the pre-surgical orthodontics. Then you have the surgery, and the surgeon takes care of the case for 2-3 weeks there. Then they send them back to you. And I think this young man moved to Denver shortly after we finished up with the case. And you can look at the difference in it. I'm going to run through it try to get it in a hurry here. We're running out of time. Now this young man doesn't have a chin, man. It's way back out of place here. So you know you're going to lengthen the jaw, and you may bring the maxilla back just a little bit, and you get the face lined up. And I don't, the upper jaw didn't shorten it too much, so your vertical height is pretty good on this young man. And so let's get with it here. And I don't think I'm going to be lecturing anybody doing something like this, but you can see what can be done. I mean, they can just work your facial structure over again. And so we took out teeth where he told us to. This was a hideous case. So he wanted the bicuspids out, so we got them out. Well, I probably had another dentist take them out, but anyway, I was working with him and recommended that too. And so he extracts the wisdom teeth also, and it looks bad. I mean, this is a tough case. And so the bicuspids are out now, and the wisdom teeth, I think he either gets them out before we does the surgery, I think, to let it heal up everything. So let's get with it. That's a per picture there, and that's not a whole lot better, but this is 1988. And here we bracket these up. Now, if you notice, he had me cut the arch wire here between the teeth back here. I think this was cut in two so that he could move these sections of the maxilla around like it is. And here we brought the lower teeth out like that. And so we tied these together where he cut this. He brought this back in that fashion. And this is after the surgery. Now we do the post-surgical orthodontics and line all this up and get an ideal occlusion, everything in the case after it's done. And so this has been done at this point. And this is 1990, and here we're finishing this young man up. And we're showing you, we started at this point, and it went to here. This is the upper picture right here after we had maybe came back when we had to line all this up. That's the way it was. And so here we finished up, and this is 1990. I see down here at the bottom. And this was 1988. And there it is in 1990. The bicuspids are out. And you can see where they worked on the young man. And we took the bias and brought the cuspids back into that space. And there it is in 1990. And here he moved to Colorado, and I left him in a retainer with a little removable lower retainer, which I don't like really. People lose them, and I'd rather bond it on, but that's what they wanted. This was the upper retainer, and we soldered this as an O2, I think 028 wire here. This is 036 back in the back, and this is just a retainer to hold the lower anterior in place. And there it is when he left for Colorado. All right, here the surgeon took the teeth out in the bicuspids. Maybe it was the same surgeon removed them and sent the case to us. I've forgotten who took them out. Now we upright this tooth, and you can upright any tooth on any body at any age, and you can do it with a little spring you put in there. You see this wire here pulls it around the upright, it with the end of an uprighting or an intruding arch wire. At his age 16 and 3 at this point, and this is 88. And there, we've straightened that out, we'll close that up. And this is 89, and he's 17 and 1 at that point. And we pull that together. This is not, well, this is after the surgery. He used these plates, see, to wire the maxilla together and screw the chin together in here. I don't, I think maybe he did a genioplasty on him, brought him out there some too. So this is surgical orthodontics, what can be done, but it is complicated stuff. And if you've done a lot of orthodontics, you may work with a surgeon and he'll let you do the pre-surgical, and then he does the surgery, and then you do the post-surgical work to finish the case up. So this is what we ended up with. And there's the screws. This young man's got plates and screws and everything all in his mouth. And these work better and let the condyle, it doesn't press the condyle into the socket and kill the disc. If you push that disc in there and leave it for several weeks or a month and a half or something like that, it'll die. So you got to have space in there. And with these little plates, like people can move their jaw around, and it keeps this disc fed right here. And that's just another where the jaw was sectioned off here and brought out. In another gap, you can see the gap in here. But the bone is different. When you're in there, they cut one side down here, and then they cut across the top, then they go to the other, and then they can slide that out, and they put the screws in there to hold it there. And now bone fills in, and your main nerve and blood vessels and everything are inside that. So you have to be very cautious when you're doing that. Okay, so here's the young man after we finished. He was wearing these glasses when he came in. But if you look at the way he looks here, and I don't have his picture, his first picture here to show you how he looked back when we started. But you get up there and look at what that, I don't think that was in there. All right, this comes together now. This is the jaw screwed back together, and this teeth will drop down in this space. So what I primarily want to do is show you what can be done orthodontically if you wanted to do that. But a surgical job like this is way out expensive to do. But in this young man's case, it really changed the appearance of this young man. Thanks for watching, and I hope you'll join our group. We've got several deals on YouTube, and this will be about 780 cases that we've made videos on.